Both acne scars, burn scars, and traumatic scars are all very similar. The scarring process is similar amongst all of those three different types of scars. Usually with burn scars, you often see a broader scarring process, and it may actually be deeper. You do see usually loss of eccrine or structures or hair follicles that can cause problems with thermoregulation as well as function. The trauma scars tend to be smaller or more localized and generally don't always have the dysfunction or the functional problems that burn scars have. The acne scars are usually more of a localized problem on the face, not so much a functional problem, but more of a cosmetic or aesthetic issue. They are characterized mostly by, or what we classically think of, are ice picks or pits on the face that represent kind of unique challenges for therapy, because it's really difficult to smooth those pits out via either laser surgery alone or any type of surgical correction. Traditionally, in treating scars, we either could put large grafts on the skin to cover up large holes, or once the scar was in place, we would try some type of surgical intervention to remove the scar or reorient scar lines. That's imperfect because really what we're doing is replacing a scar for a scar, and that doesn't always get us great improvement. We hope the new scar is going to look better than the original or function better, but oftentimes that isn't the case, and we may make matters worse. Prior to current laser technology for treatment of burn scars, the therapies mostly consisted of surgical correction with grafts or Z-plasties, or injection of intralesional Kenalog along with compression therapy. Patients were also utilizing physical therapy to improve their scarring. I think the laser is best considered an adjuvant therapy in addition to current surgical approaches for burn scars and traumatic scarring. Certainly, using the lasers that we have now, we can sometimes forego some types of Z-plasty therapy to improve range of motion or to help with wound healing. But they may be used in combination with burn scar therapy such as surgery or Z-plasties to improve those outcomes and to help with the texture and function of the skin as a long-term therapy. There are several laser modalities that we use today for all types of scars. Usually we're going to target either the color of the scar or the blood supply to the scar with pulse dye lasers. We are going to use sometimes the ablative fractional or non-ablative fractional laser therapy to target the thickness of the scar and the texture or compliance of the scar. And we might also use some lasers such as the alexandrite or some tattoo lasers to target the pigment in the scar. I think all lasers have some effect on scars to some degree. It seems that the UltraPulse has a unique profile as far as its power and pulse width that have kind of hit a sweet spot, if you will, for scar therapy. There's probably the right size and the right amount of heat and the right amount of energy that offers an ideal wound remodeling process. And so far, UltraPulse seems to have been the most successful in doing so. I think UltraPulse also has gotten ahead of the game and developed some unique profiles on their machine that allow for deeper penetration and unique density profiles that allow for delivery of energy much deeper into the scar that other machines don't offer. Therefore, it gives us an advantage in treating some thicker types of burn scars with better outcome. I think all scars respond to the UltraPulse to some degree. I will say that keloids tend to be the least responsive in my experience. We're still learning on how to treat keloids with the UltraPulse, but by and large, they respond the least. But I have treated atrophic scars, I've treated hypertrophic scars, and I've treated scars that contain some ulcers with the UltraPulse with excellent success. I will say that I would probably avoid scars that are new or still are unstable scars, especially fresh burn scars. But apart from that, it seems to be successful in most all scars. I think all patients can be candidates for therapy. You just have to be aware of the risks of treating patients with darker skin types. Certainly, if you're going to go treat dark skin types, you need to be using less energy or a lower density setting on your machine. You also have to be careful about the types of scars that you're treating. Currently, we recommend treating just stable, mature scars. New or healing burn scars probably should be left alone until they have become stable. Certainly, if there are scars that are red or erythematous, treating those scars with other modalities like a pulse dye laser to help reduce that might be beneficial before treating with the UltraPulse, just because you can aggravate those and actually make them more hypertrophic. My approach and technique with the UltraPulse is evolving. Initially, when I first started using the device, I would treat the entire scar and a small margin of normal tissue outside the edge of the scar. I would use some moderate energy settings and moderate density settings. But I think now, as we've used this more, we've tended to go toward higher energy and lower density settings to get better success. In addition, after treating the scar with the UltraPulse on the Deep FX setting, normally I will drip in 40 milligrams per cc of Kenalog on top of the treated wound to aid in the healing process. And then after that is complete, I'll finish with a light pass with the Active FX to help with texture and color. I found that to be the best approach so far. Initially, I'll treat no sooner than 1 month in follow-up. Ideally, though, patients should probably wait 2 to 3 months before treatments. I think an important tip when treating scars with the UltraPulse is when you're new using the device, you should start conservative. Even low energy settings and moderate density settings will actually be successful. I think as you get more comfortable with the device, you can start adjusting your energy settings and density settings more aggressively. But I think it's important for you to understand outcomes, have some potential failures, and learn from your mistakes, and then become aggressive later on. And understand that their numbers or the settings are not exact. There's no trial that tells you what settings that are best. This is more of a feel and feedback process. So start conservative and then tailor those settings as you get more experience. The benefits to the patient cosmetically are usually not apparent immediately. Sometimes you will have some dramatic results within the first treatment, but you would expect those benefits to happen after a few treatments because this is a remodeling process. What we do see with those benefits after a few treatments, you get a more even texture of the skin, you get a more even coloration of the skin, and you get oftentimes the thinning of hypertrophic scars, as well as if they have some types of ulcerations in those scars, you might see some of those ulcerations heal. At the same time, functionally, you get improvement in range of motion really immediately after therapy, and this is oftentimes sustained through follow-up. The range of motion appears to get better with each treatment, and there are current studies in place to actually measure range of motion improvement with the device. In addition, patients will expect to have improvement in any pruritus or itching that they have, as well as in the compliance. Their skin will just feel better. And really, this is the biggest improvement that you'll notice. That patients will come back after one visit or one treatment, and really just even a week, and they'll usually say, I don't know, but my skin just feels better. To them, it feels more like normal skin. And I think that is probably the biggest measurement of success that you'll have initially. I think the benefits to the patient's lifestyle and quality of life from the UltraPulse are tremendous. In fact, I think this is where the UltraPulse shines, even more so than the aesthetic improvement. It's hard to understand how small improvements in range of motion or in the tightness of the skin or in the pain or itching of the skin can really improve someone's daily function. I've seen patients also go from not wearing a strapless dress to being able to wear a strapless dress to the prom from treatment from their scars. I've seen patients not be able to eat a hamburger because they couldn't open their mouth wide enough to now be able to eat a hamburger comfortably. There are stories of people who couldn't reach a certain octave with the piano after burn scars to their hands that now can reach that octave. So I think it's almost unlimited as far as those benefits, and that's really the biggest pleasure you'll get as a physician using the device for your patients. Certainly there's a tremendous, or can be a tremendous aesthetic improvement, but the function and quality of life far outweighs that benefit. Well, a picture does not paint 1,000 words when it comes to the effects or the success of this SCAARFX or UltraPulse in treating scars. There are actually many limitations with being able to judge the changes in texture and compliance of the scar just based on a photograph. Really what needs to be done is you need to demo the machine or have the machine available in your office, use it on patients, and have them follow up in 1 month for evaluation, even a week later, and then probably video or interview those patients and see the response that they have. They're going to tell you that their scar feels better, it looks better to them, they're happier, their family will tell you that the patient feels different about their scar. So in this case, in this sense, it's the response of the patient that I think should be used as your best advocate for measuring success with the machine.